raising the issue, I like a brief intervention. So raising the issue is a brief intervention, and 2.5% of people actually stop smoking from a brief intervention. So what it actually does is actually help contribute to changing the overall culture that we have in our society, which is really important, because many people have started smoking in their early youth, and some of you might be old enough to know, like a Marlboro ad and things like that, when it was actually the whole society was much more open to smoking, and doctors actually sometimes recommended smoking, and so we have now moved to a much better place.
And smoked in their consulting rooms.
Yeah, so it was a very, very different place. So needing to keep that in mind when we think about what people they're having to make we are contributing to a cultural change as health professionals, but people are having to make those adjustments. And we talk about that when I do the counselling with them, which helps them process the need for change. So there's 3 tasks for clients, 3 tasks for quitting for clients, and that's making a quit attempt, and we like to focus that every attempt or everything is positive. It's very easy as health professionals to be kind of negative about like the negative aspects of health and trying to, but it's really important to keep very constructive and look at the positives, and every attempt is a good thing. Even reducing cigarette smoking is better than not. So the other aspect is coping with withdrawal and daily craving, and there is medications on the market, but I tend to have which people can use, and it's on PBS. So there are patches and things now which a lot of people don't know, and that's 3 months supply, which they can help them with withdrawal symptoms, but I would say generally that this is an assistance to help them with the discomfort of withdrawing and giving up, whereas there's actually quite a lot of work to actually do in giving up smoking. So we kind of look at the behavioural changes as the first and most important aspect of it, because if people actually latch on to the drugs, then they tend to, if it doesn't work, they feel more sense of hopelessness. So it's a matter of preparing them first, and having realistic goals is really one of the most important aspects of it. And that comes down to like adjusting to the life as a non-smoker, and so that involves a lot of issues around identity change and patterns. And can anybody tell me if they think how many people would give up by willpower from smoking?
Oh, not very many.
Yeah, 1%. Yeah, so people say they don't have willpower, and say it's actually not necessary. A lot of it is about constructive changes and patterns in their life and making those changes, like we do anything like changing weight or things that we have to do for our own health. So the important thing is that the message should not be a lecture, and it should be casual, and that kind of gets people into the feeling okay about discussing it. And windows of opportunity, basically everybody, when a client comes into the service, they're coming in from different places, and it's an opportunity, perhaps if they're conveying something to you that in the process, sometimes things come together for clients, and it can be really, and they might convey that to you, and then you can actually put that in a referral. So sometimes people say, I've tried to give up smoking at times, just casually to you, but I'm turning 60 next month, and I really want to give up smoking. That could be actually a really prime time to actually target them, because sometimes things come together for people at particular times when it makes it more accessible for them to access their own inner strength and also the services available to them. In your pack, I've actually there's something called recyclable change, and a few people have asked me, do I accept clients if they're at different stages, so they're just wanting to cut down, and certainly people can come and access the service if they've even given up, because sometimes people have just given up and that can be quite vulnerable, so you don't actually want them to go back to smoking. So sometimes people will just come for 1 or 2 sessions to talk about strategies about staying, giving up, what are their vulnerabilities and how to move around those and avoid difficulties which might entice them back to smoking. And other times it's about cutting down and looking at long-term goals about quitting, because it's not going to happen overnight for a lot of people. And there are, tobacco does interfere with, or interact with medications, often like for mental health, so we like to keep that in mind and make referrals to the GP to get them if they want to monitor their medications. And that's another good reason for sometimes to do things like that, to keep the whole context of their situation. And just something that I bring up, which often gets overlooked in the kind of enthusiasm about giving up smoking, is that there's associated issues of grief and identity loss, and that's often people might come up to someone and say, oh, it's fantastic that you've given up smoking, or it's about time you gave up smoking, and you know, look at your health, it's really bad. But often people don't realise that they actually have a sense of grief as part of the smoking, and so there's a lot of things that are associated with smoking, there's social aspects of their life, or even though we try to sort of find other ways around that, but they're just in their identity, in the way that they might carry themselves, the way they use it as a friend, or it can be a whole range of different things, but there is a sense of grief because it's been part of their life. And it's helpful if you can, as a worker, can acknowledge that, yeah, I know it's difficult to give up, you know, it's not an easy process. Yeah, and identity loss is another thing too, because it's actually changing from being a smoker to a non-smoker, which is quite significantly different for people.